Hi guys, Simon at Direct Access Vasectomy, and talking about why you might choose me. It doesn't come naturally to blow one's own trumpet, but you know, I think I offer a safe, comfortable, relatable sort of service here at Direct Access Vasectomy. Some of the benefits with touching base with myself here at Direct Access Vasectomy, no referral is needed. So you don't need to see your own GP to come along and see me. You can just present. Now, I certainly encourage you to discuss with your own GP if you've got any questions that you might have about contraception, permanent options and alternatives. Obviously, I'm very happy to talk about that with you as well. But you can certainly just call and book up. So if you don't have a regular GP, you don't need a special bit of paper or permission from anybody. You can just call and book in. We've got an online option, book in for the first free, no cost video telehealth, or you can call my reception, of course, as well, and book in that way as well. I like to talk with all my guys directly, personally. For some vasectomy providers in Australia, you know, you won't actually talk with them until the day of the procedure. You'll watch some introductory YouTube videos or a series of emails that talk through the procedure, but won't necessarily have that chance to talk directly. I suppose I am a bit old-fashioned that way. I do like to meet and talk with every guy before a procedure, and that's done these days, thankfully, with video telehealth. So you just grab a quiet conference room at work or jump in the ute at a work site, and we have that video meet up and talk through the procedure, answer any questions that you've got or partner's got, and also talk about the follow-up and aftercare with vasectomy as well. I've got some good experience doing vasectomies. Now, I'm certainly not saying I've done the most vasectomies, but I've done a lot. 1,940 or 50 as of May 2026, and I've been doing them in one form or another since 2006. So really focusing over these last 6 days since I've been here in Preston, offering it more, and it's now about a quarter of my practice. So quite confident, have sort of seen it all, thankfully, and you know, hope that I can offer a good quality service to my guys. You know that it's going to be me doing the procedure, again with some other providers. They have vasectomy providers who actually fly in from interstate, come down from Brisbane to Melbourne or down from Sydney, and then if they then fly back that night, you know, if you have a problem or a question, you know, they could be interstate already by the time you're having some concerns and need some follow-up. So you know what you see is what you get. Now, very rarely, I have been training some other doctors here. You would definitely know about that if it was going to happen, and I'll be very clear through the process. And to say thank you for helping with training, we offer a reduced fee there. But 99% of the time, it's going to be me having the initial discussion, having the procedure with you, and doing the follow-up and the aftercare as well. I use the Lee no scalpel technique, which is, you know, really the standard in Australia now, but I think it has terrific evidence around excellent contraception effect, lowest risk of problems or complications around and after vasectomy. And although I counsel guys to be mindful that vasectomy is a permanent procedure, if there is a change of heart, it does leave the door open to vasectomy reversal down the track, unlike some older, maybe more extensive procedures there as well. No stitches removed, so nothing to be removed afterwards, everything dissolving. You're here 45 minutes, procedure itself 15-20, and then loading up with pain relief paperwork and getting you home. So really wanting you to return to work, sex, sport as quick as possible. I think hopefully it's quite clear about finances. As of May 2026, $755. We do ask for a $100 booking fee when you book in after the telehealth. Then paying that remaining $655 on the day, $228 will come back from Medicare. We don't qualify for any private health rebates because we're not a general anaesthetic procedure in a big fancy private hospital, but the benefit is we're not paying those gap fees or private hospital fees, and so significant cost savings compared to a private hospital procedure. And I'm certainly confident the procedure itself is exactly the same. We just don't have the fancy grand piano and chandelier in the foyer like a large private hospital that you're paying for. We are convenient in Preston. We're on the corner of Bell and Plenty Road here in Preston, diagonally across from the Stolberg Hotel, if you know that. It's very easy for guys across the north. We've got the 86 tram outside, and we've got the Bell Street train down the line, you can walk to that. I have had one guy turn up on a bicycle. I made him catch an Uber home, but certainly we're convenient, across northern Melbourne. I think I offer good, thorough care throughout the vasectomy journey, from that initial consultation, the procedure, and any follow-up. And I hope the Google reviews sort of bear that out as well from guys. Of course, not easy to put your name and say you've had a vasectomy, so thank you to the guys that have put their name to that over time. So if you're ready to take the next step, you can use the online booking for the video telehealth for that first consultation. Again, you don't need a referral from your doctor, but you're welcome to bring one or discuss with your own GP. Your partner's welcome to come along for the telehealth consultation as well, or I can answer any questions they've got if they're not able to be in with you. We're generally sort of a couple of weeks out, and we can follow up with you and answer any questions. So, love to see you, chat, book in, at least have that discussion, decide if vasectomy is the right thing for you, and we can go from there.